Hi, I'm Megan Westling, and I am a doctor of physical therapy and also a registered yoga teacher.
And I'm Amy Simmons. Good morning. And I am a physical therapist, and I'm also a therapeutic pain specialist. And both of us work at Weber Physical Therapy.
All right, so today we're going to be talking to you about what to do if you have low back pain. So we know back pain is really common. The prevalence rate is about 70 to 80%. That means sometime in our life, that many of us will experience back pain. And the recurrence rate is even crazier. It's like 41% within 3 years will experience those symptoms in some form again. So really, how can we protect against this? Physical therapy is such a great option for first line defense because it's kind of one of those things we feel like will go away and we don't really do anything about it. And by these numbers, that's true. It doesn't just go away on its own. But we can really get those numbers down with coming and seeking some further care, especially with physical therapy. So Amy, kind of what types of people do we see in PT for low back pain?
Super wide variety. So it can be somebody that's, moved somebody over the weekend. They haven't had, back pain before, and all of a sudden, their back flared up and now they can't bend. It can be somebody that has had this nagging pain every time they run longer distances, and it, doesn't allow them to do that. It can be somebody that got hurt in an accident. We just see such, a wide range of people.
Right.
What would you suggest, Megan, in any of those scenarios, what could somebody do as a first thing on their own?
Yeah. So since back pain is so individualized, it's not really one type of back pain. It might be a nagging pain or something that's a little more severe. But regardless of that pain, we've got to do something about it, right? So at home, acutely, we can use ice. We know that ice helps with inflammation. So especially within that first 24-hour period of noticing some symptoms, ice is really helpful, about 10 minutes. Heat, same thing, but more subacutely to chronically. So that's going to help with muscle stiffness. So again, 10 to 15 minutes of heat will really help take care of some of that tightness and that guarding that we experience after the acute onset.
Would you agree that movement is key?
We need to have movement, right? We know that, 20 years ago, 50 years ago, we were saying more bed rest, don't do anything. And evidence really shows we need to move to get better. Mm-hmm. Yes.
And that's one great way I think that therapists can help if you're not able to keep moving or, do the moving you want to do.
Right.
Because it is so important.
But people are sometimes fearful of which movements to do. And
Right.
Physical therapy can really help with form, whether it's looking at your jogging form or your squat. So we're going to kind of focus in on the squat today as we kind of continue on with our discussion.
Yeah. So why don't we talk about what are a couple of exercises that somebody can do, in this big range of possibilities, but two that we find to be really helpful.
So when we're looking at back pain, I think the first place to start is mobility, right? So if we have a desk job, we can work on just some seated rotation using maybe our arms to help us. And then maybe even holding that using our obliques, so our abdominals to gain that strength. And then working our way back and, of course, using our breath to help us. Rotation actually offers traction to the spine. So it gives you space between your spine bones or your vertebrae. Mm-hmm. Yeah. What's one more thing we could do? Maybe more of a stability exercise.
Yeah, I love things that are related to, how we need to move in life.
Yeah.
And so squatting. So just doing a very simple.
Something more functional. Yeah, good. So if we kind of moved in to hear from our physical therapy evaluation, we could take a look at Amy's squat. So a lot of times people do not know what to expect at physical therapy. It's kind of a term that we just think, oh, they're just going to give us some exercises. And I could probably just do those at home. But it's more than that. We're going to look at actually how you're moving. So let's take a look at Amy's squat here. So give us another squat, Amy. So we can kind of tell here, besides just looking at that squat, she's got some issues going on with her ankles here. So that could tell us that maybe there's some weakness in her foot muscles, or maybe that she just has some lack of mobility through her ankles. We can also see those knees kind of dropping in. So that could tell us she maybe got some weakness through the glutes, or it could be some hip mobility. So we, just by looking at that, are gaining information And then we'll further assess in a physical therapy evaluation, do some mobility testing and some strength testing. So let's take a look maybe at some of that. So go ahead and lie on your back. So we're just going to take a look here at her hip mobility. And that seems to be pretty much checking out on this side. So this is just a really quick screen. And then from here, just to check the strength on her hip, I'm going to have her roll onto her side. And then Amy, I'll just have you lift your right leg up and kind of turn that foot down a little bit and hold your leg there. Don't let me move you.
Yeah, that's tough.
Yeah, that is hard. So we know strength is one key factor for her that we would work on. So I'm going to have you stand. We're also going to take a look at her SI joint. So I'm going to have her take a little side bend to the right. Beautiful. To the left. A little bit stiffer there. And lift up that right leg. Nice. Left side. And that's good too. So we can see there's some stiffness, or I can see there's some stiffness on that left side. And with all this information, we're going to take that to the next point, which is treatment. We were looking at her SI joint, which is basically where the pelvis is meeting the sacrum, which is the lower part of your spine. We saw that that left side was a little bit tight. So I'm going to have her lie on her right side. We're going to use her muscles here to actually pull that joint back. So Amy, I'm going to have you roll your shoulder back a little bit. And just relax this leg here. Good. And then I'm going to have you push up towards the ceiling. You feel how that's engaging those muscles there? Good. So, in a treatment session, we would do this a few more times. And it's just one of many of our modalities that we use, options, techniques that we have as trained physical therapists to help you with your movement. So,
So besides mobility and strength testing, Megan, what are some other things that would a therapist do differently than something I can get online?
Well, we definitely want to look at how someone's moving, maybe looking besides just at that functional movement, also look at how they're walking and looking at their posture. So maybe if somebody's sitting at a desk all day, basically we're just gathering information. And then right away that information can be taken into treatment. So right away in that eval portion, which is about 60 minutes, half of that will be treating.
I agree. It is really important what somebody is doing throughout the day, the rest of their life, that is affecting their back.
Right, and they're just getting a lot of knowledge too, right? Because we don't want someone to have to be coming back over and over again. We should be seeing progress after the first couple treatments and eventually progressing them towards self-management at home.
Right.
Yeah, and getting them back to maybe they're a CrossFitter or they like to do yoga, whatever that is, or maybe they just want to be able to drive to work. So any of those goals, we discuss with the patient, create that individualized plan of care.
Sounds good.
All right.
So Megan, say you've been heating and icing and you've tried some simple exercise, you've done a little walking and things just aren't changing. When do I go see a therapist?
Yeah, so there's no wrong answer here. That could just depend on the severity of your pain, right? So if you're having something that's really nagging you, you might want to get into therapy the next day. Or if you're someone who's like, I think I can kind of manage this on my own, waiting a week is fine too. But at any point when you're feeling like maybe your symptoms aren't getting better or they're just kind of plateauing, physical therapy is such a great first line of defense.
Would you agree that we're finding that research evidence is showing that the earlier intervention, the better outcome that people have?
Definitely.
So
hopefully you've gained some information here on low back pain and some options to self-manage at home and kind of understanding better how physical therapy could help you with these symptoms. We'd love to see you if you're experiencing any low back pain. So
thanks for spending time with us.
should I be facing you?